Okay.
Yeah.
Thank you for that. And good morning and good afternoon, colleagues again in the different parts of the world where you are. My name is Leruo, as already introduced, and I'm a veterinarian working in the Department of Veterinary Services in Botswana. I spent a lot of my time working in the lab, so I appreciate very much this training, which is focusing on the abattoir antemortem, post-mortem activities, looking at the clinical signs and the pathological signs of CBPP. And of course, as we have already been discussing from the presenters before me, it is important, the field activities, and as well to engage the community, especially the traditional leaders, to recognize the disease. I think that I will go quite quickly. I am going to focus on the differential diagnosis for CBPP. And we have already seen a lot of slides showing the pathology that you can get for CBPP. And the clinical signs for CBPP have also been covered. And it's just important to recognize that CBPP can present in the hyperacute, acute, and chronic forms. And you will see the hyperacute form you may not even perceive, but the acute form is where you are likely to see the clinical signs, as has already been discussed. And then in the chronic presentation of CBPP, you will see emaciated animals with a cough. We looked at the pathologic lesions of CBPP, and then this is just to refresh your mind, because really we are looking at utilizing the work that is being done at the abattoirs. We talked about the meat inspectors. We want to be able to use the abattoir as a surveillance point for CBPP. So it's important that where we have these lesions, which are very characteristic of CBPP, Massimo has really explained them at length and very well. It is important that our suspicion for CBPP should be very high when we see these lesions in the abattoir. And then I will proceed to look at some likely differential diagnosis that you can come across at postmortem. The first one we will look at, which has also been discussed by the previous presenters, it is just now to really narrow it down. I will focus on the ones which are very closely related or can cause confusion when we see lesions of CBPP, whether in the field or in the abattoir. But really, we are talking just lung lesions or pneumonia that presents. So the first one we will look at is Mannheimia hemolytica and Pasteurella maltosida. So Mannheimia hemolytica, um, Mannheimia hemolytica, sorry, let me go back. Okay, Mannheimia hemolytica serotype 1 is the bacterial pathogen which is frequently isolated from the lungs and is seen in young weaned feedlot animals. And it's usually associated with stress and causes respiratory disease. And Pasteurella maltosida is another important bacterial cause. The clinical signs that will be seen are a combination of depression and fever, and general respiratory signs. And then we will move on to the pathologic signs of Mannheimia hemolytica. These would be severe acute hemorrhagic fibronecrotic pneumonia. And then grossly, the extensive reddish black to grayish brown cranioventral regions, but we will look at the pictures. But you can already see that Mannheimia hemolytica can closely resemble CBPP lesions, and the same for Pasturella maltosida. So this is Mannheimia hemolytica, and we can see that there's a portion maybe of normal lung, but it's important to focus on the pathologic area where we see a lot of consolidated, red consolidated lung and a lot of fibrinous effusion in the lung and involvement of the pleura and the lung. These are some of the lesions you can come across. But of course, CBPP being such an important disease, it will be a matter of ruling out these differential diagnoses, but high on your list should be CBPP. And this is another picture showing Mannheimia hemolytica with the pleuritis there and pleural effusion. And then we can see an area of consolidated lung under the pleuritis. These pictures we have seen before. They are also Mannheimia hemolytica, and we will move on. And this is the cross section that we see for Mannheimia hemolytica, and you can see that there is some extension of the interlobular septi, and you can see the hepatization and different stages of disease progression with some necrosis as well. So a picture like this at postmortem, really we should be thinking, in my opinion, I will be thinking CBPP. And this is where sometimes we have to consider further diagnosis, but we also have to consider, as was mentioned before, the history of these animals. And then with the template that is being developed, it will be good also to record these lesions that you have seen so that we are able to pick CBPP at this stage with the resources that we can be having. This is Pasturella maltosida. You can see a lot of pleuritis and consolidated lung, and perhaps you can also see the mediastinal lymph nodes are enlarged. That is very similar to this lung which we have seen, which is for CBPP. With you can see the omelette there, from the pleuritis and the mediastinal lymph nodes. So it's very important that we have these differential diagnoses that can look very similar to CBPP. The other one to consider is bovine herpes virus 1 or infectious bovine rhinotracheitis. This can have, of course, several clinical manifestations. It's called IBR, but it can also present as infectious pustular vulvovaginitis, balanoposthitis, even conjunctivitis. We will see a picture with the conjunctivitis and abortion. But most lesions of infectious bovine rhinotracheitis or IBR are confined or restricted to the upper respiratory tract, the trachea in particular. Here we see conjunctivitis. So at antemortem, we should be able to. This is very easy to pick up, and obviously at the abattoir, this is a sick animal that should not go into the food chain. But of course, further investigation by postmortem or even submission of diagnostic samples to the lab should assist you to make a diagnosis. And this is the rhinitis that is caused by IBR on the left. And we can see the tracheitis, the hemorrhagic lesions, and infective process that we can see with infectious bovine rhinotracheitis and the accumulation of fibrinous material in the lumen of the trachea. We can have mixed infection. So in this case, this is the lung that was presented at postmortem. And on further investigation, it was infectious bovine rhinotracheitis with Mannheimia hemolytica infection. So you can see that we have an enlarged lung. We have enlarged interlobular septi, even some emphysema and hemorrhagic process consolidation of the lung. And this as well, the cut section of the lung with a mixed infection of IBR and Mannheimia hemolytica. You can see involvement of the pleura there, thickened pleura, enlarged interlobular septi, and the lung at different stages with the hepatization that we have seen before. So this picture can be confusing at the time of the investigation. So CBPP should still be high on your index of suspicion. The other differential diagnosis to consider is bovine respiratory syncytial virus, which is often associated with bovine parainfluenza virus 3, often affecting young calves or young stock. And it's usually associated with stress. So the clinical signs that you may see is the fever first will develop, a very high fever reaching 40 degrees Celsius, depression, lack of appetite and anorexia, and of course the respiratory signs when you have bovine respiratory syncytial virus infection. The lesions at postmortem are similar for both viruses, bovine parainfluenza 3 virus and bovine respiratory syncytial virus. The most common macroscopic lesions, you'll see multilobular consolidation of mainly the cranial lung lobes. And emphysema is characteristic of bovine respiratory syncytial virus infection, but it's generally not seen with bovine parainfluenza virus 3 infection. You can see a lot of frothy effusion there in this section and a lot of edema in the trachea and bronchus and the lungs. And here you can see hemorrhagic lung with a lot of edema and very enlarged. And the emphysema there is also evident, which is associated with bovine respiratory syncytial virus. And you can see the same picture here. So we will move on. A lot of consolidated hemorrhagic lung, and this is more representation of the emphysema that you are able to see. But you can also observe the shiny surface due to the edema and not much pleuritis here, but you can see the lung pathology. And this is the cut section, so showing hemorrhagic processes and the start of the consolidation and hepatization in the lung. But you can compare this to CBPP because even with these differential diagnoses, we should always have in our minds what is it that looks like CBPP. And with every suspicion, where possible, we should consider that it is CBPP until ruled out by further investigation, usually by sending samples to the laboratory. Mycoplasma bovis is another differential diagnosis which causes chronic respiratory disease and arthritis, usually in feedlot cattle and in young dairy calves. The clinical signs of Mycoplasma bovis, they are associated with otitis media, but usually as well with the syndrome for chronic pneumonia, but also polyarthritis in feedlot cattle and young dairy and beef calves. The lesions that you would see with Mycoplasma bovis infection are chronic bronchopneumonia with caseous and coagulative necrosis. And a lot of the animals, 40 to 60%, about 50% may develop polyarthritis or tenosynovitis, which causes severe chronic lameness. And the condition results in chronic disease and does not respond to antimicrobial treatment. And then remember as well, the One Health approach, even at antemortem, postmortem, to look for lesions which could be indicative of antimicrobial treatment in the animals, because we know that often even farmers may treat animals themselves when they are sick. We can see here with the cranial lung lobes, the consolidation starting, and also enlarged edematous lung for the early lesions of Mycoplasma bovis infection. These are the more chronic lesions with a lot of small sequestra through the lung tissue. We can see the hepatization there. We can see the enlarged interlobular septi, and also paying attention to the pleura, the infected pleura, the pleuritis, which is enlarged. And you can see the yellow appearance of the pleura there. This is another chronic lesion. And in other areas, the lung looks normal per se, but you have a sequestra here, and you can see the necrotic tissue within the sequestra. And this is another smaller sequestra. So we have seen these examples, and we should bear them in mind. And of course, also remembering that with Mycoplasma bovis, often in 50% of the time, you will have arthritis. So it's important to observe that as well. At the end of the day, if you put them side by side, you can also have a mixed infection, in this case with Mycoplasma bovis and Mannheimia hemolytica on the left. But if you compare on the lung for CBPP on the right, even the gross presentation, just looking at these two slides, can still be quite complicated, not very obvious. Bovine tuberculosis is the other differential diagnosis that I have included here. And just to know that we can have Mycobacterium bovis as well, and other mycobacteria such as the Mycobacterium avium complex, which includes Mycobacterium avium and Avium hominis suis. The clinical signs of bovine tuberculosis are a progressive emaciation over time, lethargy, weakness, anaerobics, and diarrhea with low-grade fluctuating fever. But there can also be at postmortem, a bronchopneumonia can be observed, and then you will have respiratory signs, which are chronic with an intermittent moist cough, and later signs of dyspnea and tachypnea. So these are at antemortem. It's important to pay attention to the respiratory signs so that you know that you may have lung pathology involved in the disease process. The lesions that are seen with bovine tuberculosis infection is due to the the process of the infection in the lung with the phagocytosis of the bacilli by the alveolar macrophages. And then the mycobacteria proliferate in the lung tissue, and you get at the later stages the formation of the granulomas, which consist of dead degenerate macrophages surrounded by epithelioid cells, granulocyte. So this is how the granuloma is formed. The purulent tucaceous necrotic center may calcify, so it may become hard. So palpation, on palpation, you'll see that it's caseous. And we talked about how to differentiate with the sequestra for CBPP, where bovine tuberculosis is concerned. That is one of the ways. And then the lesion may be surrounded by a granulation tissue and a fibrous capsule. So this is the picture we have seen before of bovine tuberculosis with multiple lesions in this lung, which present like sequestra with that caseous material with a capsule that you can see. And then again, we have seen these photos before just to put side by side to really see how well can you differentiate at postmortem. We have bovine tuberculosis there. We can see the granuloma there with the caseous material inside and a fibrous capsule. And we can see for CBPP the necrotic tissue within the capsule as well. So you can appreciate in that really in some cases with these differential diagnoses, it can be quite difficult. And then looking at the lymph nodes, which you need to pay attention to before. And we saw the lymph nodes for CBPP are also affected, but these are the lesions that you can see within the lymph nodes for bovine tuberculosis infection. The caseous material there with the fibrous capsule. This is the last one that we will look at, and I hope we are not doing too badly for time, but we'll look at actinobacillosis, which is an infection by Actinobacillus ligneraceae, which causes tumorous abscesses of the tongue. It's often referred to as wooden tongue, but we have to be aware that it can affect other parts of the body. So we may see polygranulomatous lesions in the soft tissues around the head, neck, limbs, and occasionally the lungs and lymph nodes, pleura, udder, and subcutaneous issue. So here we have a picture of the tongue. But as I mentioned, we can see lesions in other parts of the body, on the neck, the oral cavity, but it's important to, in this case, I'll focus on the lesion there in the lung. We have a hemorrhagic looking lung, also with interlobular septi. They're quite enlarged, but you can see this looks like a sequestra. So this is something also to be aware of. And also the involvement of the lymph nodes. These are the sort of lesions with actinobacillosis on the left. Those nodular caseous lesions, but with CBPP, they're slightly different. This is the lymph node necrotic as well. So this is the end of my presentation, and these are the differential diagnoses that I have covered here. These are the ones which I consider that they closely resemble the CBPP lesions. But of course, we have seen heart water, and we have mentioned other differential diagnoses, which especially looking at the pleural effusion could be confused with CBPP. And it's always important to consider those as well. Thank you.
Thank you very much, Dr. Leruo, and you have managed to catch up with the time despite those technical challenges before.